10 silent symptoms of pancreatic cancer you must know. Pancreatic cancer is often called a silent killer. Why? Because its early symptoms are so subtle, many people ignore them until it's too late. But the earlier we detect it, the better the chances for treatment. In this video, you'll learn about 10 early signs of pancreatic cancer you should never ignore. Some may seem harmless. Some may surprise you. But all of them matter. Let's get started. The first and most visible sign is jaundicing of the skin and the whites of the eyes. This happens when a tumor in the pancreas blocks the bile duct, causing bile to build up in the body. The result is a yellowish tint that can appear slowly or suddenly. Many people think of jaundice as a liver problem, but when it appears with no known cause, it could be a sign of something deeper. If you notice yellowing in your eyes or skin, especially along with dark urine or light-colored stools, talk to a doctor immediately. Before the skin even turns yellow, your urine might darken to the color of tea or cola. This change can be caused by rising levels of bilirubin in the bloodstream. Dark urine can also be due to dehydration, but if it persists, despite drinking enough water, it could be a warning sign. It's easy to overlook, but your body may be sending you a message. Listen closely. Your stool can tell a lot about your health. If it becomes pale, greasy, or floats, this may mean your pancreas isn't releasing enough digestive enzymes. This leads to poor fat absorption, which changes the texture and color of your stool. Sometimes it looks like clay. Sometimes it's unusually oily. If this happens frequently, it's not just your diet, it may be your pancreas struggling. One of the most alarming but common symptoms is losing weight without trying. Even if you're eating normally, pancreatic cancer can interfere with digestion and how your body absorbs nutrients. You may feel like you're eating enough, but your body is starving on the inside. If you lose 5 to 10% of your body weight in a short time without dieting, don't brush it off. It could be more than stress. It could be a sign of cancer. Pain that starts in the upper abdomen and radiates to the back is a red flag. The pancreas sits deep in your abdomen, behind the stomach. When a tumor grows, it can press on surrounding organs or nerves. Some describe the pain as dull and persistent. Others feel it intensify after eating or when lying down. If this kind of pain lingers for days or weeks, it deserves medical attention. Suddenly losing interest in food. Feeling full after just a few bites. That's not always due to stress. Loss of appetite is a frequent symptom when the digestive system is disrupted. It may be related to changes in hormones, slowed digestion, or tumor pressure on the stomach. Over time, this can lead to fatigue, weakness, and yes, intentional weight loss. Don't ignore it if it becomes a pattern. Nausea and vomiting can happen when a tumor presses against the stomach or intestines, affecting digestion. It may start out as occasional discomfort after meals, but can become frequent and hard to ignore. You might assume it's food poisoning, indigestion, or stress. But when nausea lingers, especially with other symptoms like weight loss or fatigue, it's time to look deeper. Your body might be reacting to something more serious. This may surprise you. A sudden diagnosis of type 2 diabetes could be linked to pancreatic cancer. That's because the pancreas produces insulin, which helps control your blood sugar. When a tumor disrupts this function, it can cause blood sugar to spike. If you've recently been diagnosed with diabetes, especially if you're not overweight and have no family history, don't ignore it. Mention it to your doctor, especially if other symptoms appear to. Everyone feels tired sometimes. But chronic, unexplained fatigue is different. It's that deep sense of exhaustion that sleep doesn't fix. Cancer drains the body's energy. Add poor digestion and low nutrition, and your body begins to feel weak and worn out. If you feel constantly tired even after restand, it doesn't improve. Trust your instincts. It may be more than just burnout. Pancreatic cancer increases the risk of blood clots, especially in the legs known as deep vein thrombosis. You may notice swelling, redness, or pain in one leg. In more serious cases, the clot can travel to the lungs, causing chest pain, difficulty breathing, or even collapse. These symptoms require immediate medical attention. If you don't have known risk factors, like smoking or surgery, don't overlook them. None of these symptoms alone confirm cancer, but several of them together. That's your signal to act. Pancreatic cancer is treatable, but only if caught early. If you notice yellow skin, strange digestive changes, new diabetes, or extreme fatigue on weight, talk to your doctor. Early detection can mean the difference between life and loss. If this video helped you, please like, comment, and share it with someone who needs to see it. And don't forget to subscribe to Healthita for more life-saving health tips every week. Please remember that this content is for informational and educational purposes only. It is not a substitute for medical advice, diagnosis, or treatment. Always consult a healthcare professional for concerns. Thank you for watching. Stay informed. Stay healthy. See you in the next video.